With that said, we will begin our opening plenary, which is a call to action, women's unique health needs and the Sustainable Development Goals. At this time, I'd like to invite Dr. Rufang Chang, the Director of Women's Health Innovations at Bill and Melinda Gates Foundation, to the stage. We can get some assistance. Dr. Chang leads a team that supports the development and adoption of high-quality health products that address the needs of women and girls in low and middle income countries. The Women's Health Innovations team also serves as a unifying voice on women's health, collaborating with other foundation teams and external partners to direct more funding and attention to R&D for women's health. A board-certified obstetrician gynecologist, Rue joined the foundation in 2023 after more than 15 years in the biopharmaceutical industry, where she held roles of increasing responsibility in the clinical development of drugs and devices for women's health at Johnson & Johnson, Bayer, and Pfizer. Earlier, Rue was an assistant professor at Rutgers Robert Wood Johnson Medical School, where she served as a clinician, educator, and researcher and oversaw gynecologic ultrasound unit. This time, let's welcome, these are her disclosures, and please help me welcome Dr. Chang.
Hello, can everybody hear me okay? Good morning. Hi, everyone. What a pleasure it is to be here with you. I'd like to just first off say thank you to Society of Women's Health Research and ECH Alliance for the invitation to be here and to share some thoughts with you about women's unique health needs. As Irene introduced, my name is Rue Chang. I'm a physician. I'm an OBGYN physician, and my current role is I'm the Director of Women's Health Innovations at the Bill and Melinda Gates Foundation. It is really a pleasure to be here with you all today. As a physician specializing in women's health, I've spent most of my career caring for women. It's really been a privilege to do so, and one thing that's been super clear to me in that time is that women prioritize other people above themselves. I'm looking across the room and I see several women in here, and I know you know what I'm saying. We think about our kids, we think about our parents, our partners, our neighbors, our colleagues, and we put all those people ahead of ourselves. And because of that, women often don't have enough support for their own health needs, for their own individual issues. So whether it's trying to get a diagnosis or a treatment, women's health frequently comes second. As a clinician, I can tell you there have been many examples in the past where I've had a patient in my office come in and say, oh, I need to be out of here by a certain time because I need to meet my child at the bus stop. And so can we quickly just move through this appointment so I can get back home and get to the bus stop? This week, while we're all gathered here in New York to discuss what progress is needed to build a better world, we have a chance to pause and think, how can we put women's health first? If we don't, the stakes are high. We take a risk that we're missing out on achieving the Sustainable Development Goals and the healthier, more equal societies that come with them. In the past 100 years, we have cured diseases, we have developed life-saving vaccines, and we've expanded our lifespans. But despite all these unbelievable accomplishments, the health of women remains largely overlooked, and that's hurting each and every one of us, even those who are not women. Women's health has been stuck in a cycle. It's vicious and it's pervasive, and it spans from the inception of innovations all the way through the care that women receive every day. Early in my career, I remember talking with a colleague who said to me, who does the work shows up in the work. And I think that crystallizes very well what's been happening in these years, as Irene pointed out, that women have not been involved in research. Women have historically been sidelined in the innovation process. Women hold fewer leadership roles in the R&D space. 41% of full-time faculty at US academic medical centers were female, and only 25% of full professors and 18% of department chairs and deans are women. Globally, only 12% of members of national science academies are women, and only 2% of the top pharmaceutical companies are led by women. This means that women are not at the table. They are not making decisions. They are not informing where investments are being made in terms of what gets researched and what gets funded. Consider this. In the US, we're entering the fall season. In 2019, Americans spent $9 billion, that's B with a B as in boy, on Halloween costumes, candy, and decorations. And 490 million of that went to costumes for their pets. Not to throw shade on pets, pets play an important role in our support system. But by comparison, $64 million was invested in contraceptive R&D globally in that same time frame. So just to put some numbers to it. The gender gap is also reflected in how science is conducted. Science from preclinical studies with animals to human trials is largely centered on male subjects, which leaves huge blind spots in our understanding of how sex and gender impact different health conditions, treatments, and innovations. While we have seen some improvements in terms of clinical trials, women are still continuously underrepresented in those trials, especially in areas like cardiovascular disease, psychiatry, and cancer, relative to the burden of these illnesses that we carry. The representation in the trials is not commensurate with the prevalence of the conditions. As a result, our understanding of these diseases and our treatments are largely based on how they manifest in men and not women. The consequence of this gender gap is that we've seen fewer scientific advancements, tools, and treatments designed for women that have actually reached patients. Even when we do focus on women, it's in the past known as what's called bikini medicine. So just covering conditions that affect the parts of the body that are covered by a bathing suit. And so they've revolved around female reproduction. And while, of course, that's very important and unique for women, we really need to consider the whole woman. This is a huge failure and should be a signal to all that the opportunity is there for the taking if we simply prioritize women's health. Another unintended consequence of the lack of innovation in women's health is we're generating less data and insights on how health issues may affect women uniquely or differently. As a result, clinicians who are studying medicine today in medical school are learning very little or information that was generated in studies decades ago about women's health. One example is in the 4 years that medical students in the US spend in training, they spend 1 hour learning about menopause, which is a condition that affects nearly every woman. These students then go on to become practitioners, and they don't really understand women's health needs as strongly. And because of this, women experience gaps in care, whether we are more likely to be misdiagnosed by doctors and less likely to receive timely and effective responses to our concerns. For example, women are 7 times more likely than men to have heart conditions misdiagnosed and to be discharged during a heart attack because the symptoms that women present with are different. They are not the classic ones that doctors have been trained on. This situation is even worse for women of color and women living in low and middle income countries, all of whom consistently face more barriers to accessing care and struggle to have their needs properly heard. Taken all together, each of these pieces ultimately lead to women spending 25% more of their lives in poor health compared to men, which certainly has knock-on effects in terms of careers and the time we spend with our families and our participation in society and the economy as a whole. So I just threw out some statistics that are not super optimistic. But the reality is we can turn this situation into an opportunity for all of us. It is a misconception that women's health is a sunk cost, a cost that begins and ends with women. But in fact, it's quite the opposite. Investing in women's health can unlock countless benefits for all of us. We need countries, donors, innovation partners to realize this, so we can improve billions of individual lives and lift up entire communities in the process. It is my hope that leaders gathered in New York at the General Assembly begin to see what's always been directly in front of us all along, that women's health underpins the world's Sustainable Development Goals. If we start with Sustainable Development Goal 3, health and well-being, investing in women's health helps everyone rise because when women are healthy, they keep their children and their families healthy too. SDG 4, quality education. Investing in women and girls' health, particularly around family planning, is key to making sure that girls stay in school and can achieve their full potential. SDG 5, gender equality. Investing in women's health means that women and girls have more bodily autonomy and can make decisions about their future and their health. SDG 8, decent work and economic growth. When women can be well, they do well. An analysis released by McKinsey earlier this year found that investing in women's health has a potential to boost the global economy by $1 trillion, trillion with a T, which represents a 1.7% increase per capita GDP annually by 2040. That's a lot. Investing in women's health has a good return, for sure. To achieve all of these positive impacts and more, we need to take several decisive steps. We need to invest in the innovation for women's health, ensure that new solutions reach women who need them, and center women across the R&D system so they can play a role in creating tools designed to serve them. At the Gates Foundation, we are committed to doing our part to advance women's health and deliver on the world's SDGs, particularly those focused on ensuring good health and well-being and achieving gender equality. Among the many areas we work on, there are 3 that I'm excited about and would like to share with you. The first is innovation to develop new contraceptive options. Family planning has the potential to transform women's lives and unlock their economic potential. It means women can finish their education, pursue their ambitions, invest more in their children and their families, and manage their fertility. We know that 40% of women in low and middle income countries who actually begin using family planning methods will stop within the first year because they're not satisfied with their methods. This is a way of telling us as innovators that we need to do better. In some cases, these methods did not meet their needs or lifestyles, and in others, seeking the care was too costly or inconvenient. New contraceptive technologies and improvement to existing methods promise to better respond to women's needs and preferences. For example, depomedroxyprogesterone acetate subcutaneous, DMPASC, or Cyanopress, is an injectable contraceptive method that is long-acting, 3 months. It's very discreet, and it's designed to be, sorry, I'm not waving at my arm here, it's designed to be self-injected or injected by health workers, community health workers that can be trained to do the administration. And by doing so, it increases the access to the product. It saves time, money, and effort of visiting a healthcare facility. We're also investing in a very novel approach to delivering contraceptive, which is a microarray patch that applies to the skin like a Band-Aid, and it uses tiny projections to release hormones over a period of several months, offering women a discreet and pain-free method of contraception. These technologies are important because they meet women where they are and address some of the most persistent barriers to family planning, including the need for frequent contact with the healthcare system to access contraceptives regularly. But more importantly, these tools are empowering. They put the choice back in the woman's hands, giving them control over their own care when and how they want it. The second area I'd like to highlight for you is around testing and diagnostics for sexually transmitted infections. STIs are not a woman-only condition, but they do affect women disproportionately because of the longer-term health impact. Things like pelvic inflammatory disease, infertility, adverse pregnancy outcomes, increased susceptibility to HIV acquisition. Millions of women in low and middle income countries do not have access to accurate STI diagnostic tests. Even when testing is available, it can be inconvenient or expensive or a lengthy process to get the results. Because of this, providers often diagnose based on symptoms, which is great for men because they are more likely to present with symptoms. Women, however, are frequently asymptomatic. About 50% of the time, chlamydia infections are completely without symptoms. Overall, this leads to important underestimates in the sexually transmitted infections disease burden, and it makes it harder for women to receive the proper care they need to treat and prevent infections. And because we don't have a good handle on the true rates of these infections, it doesn't draw the eyes of other investors and people who can make decisions about supporting this area. At the foundation, we're investing in simple, low-cost point-of-care diagnostics that can help reduce the spread of STIs by providing quicker, more accessible, and more affordable testing options. During COVID-19, we all got comfortable with testing ourselves, from swabbing to reading results. Now, if we could do the same thing for STIs, that would really facilitate and empower women to take care of their own health conditions and make sure that they get treatment that they need. For many women, there's also added stigma linked to infection or STI complications. That's why we're working to improve visibility and understanding of how STIs impact women differently and to break down misconceptions and protect women from any long-term health impacts. And finally, the third area that we're focused on is gynecology and menstrual health. For too long, the medical community has limited its focus on women's reproductive health, overlooking the full spectrum of conditions that affect women throughout their lives. As a gynecologist, this is exactly what I'm interested in. We are investing to understand and to identify where there are knowledge gaps across the full spectrum of women's reproductive health, including conditions that are getting more attention now, but we know are quite common. Things like endometriosis, bacterial vaginosis, polycystic ovary syndrome, and menstrual disorders, to help shape new tools that can help women and girls manage their health safely and with dignity. We are also advocating for better standards for menstrual hygiene products, because in many parts of the world, these products are not subjected to any standards. And as an example, there was a recent report that tampons in the US, UK, and EU contain toxic metals, things like lead and arsenic and cadmium. Without better quality requirements, women have to be dependent on products like these, which can create worse health problems in the long term. Of course, these tools, contraceptives, STI tests, and better menstrual products won't just deliver themselves. That's why we also invest heavily in strengthening commodities procurement and delivery platforms that will truly reach all women at the last mile. This is the start of an exciting time. After decades of neglect and overlooking women, the tide is finally turning on women's health. We are starting to see real momentum to close research gaps and foster new innovation for women. This, in turn, is supporting essential work to improve gender equality and health around the world, advancing the world's SDGs. In the US, we've recently heard an announcement of a new initiative. In March, President Biden signed an executive order to advance research and innovation on women's health, which included a comprehensive set of executive actions to expand and define research on women's health. And I know we'll hear more about it later today. Included in that was a commitment to $100 million in funding to promote women's health innovation and accelerate research. Last year, we participated in a convening that was co-hosted with the NIH Office of Women's Health Research of 250 women's health experts, with the goal of charting a path forward to transform a women's health innovation ecosystem. The result of this gathering was the Women's Health Innovation Opportunity Map, a report that outlines 50 equitable high return opportunities across the R&D continuum to advance innovations to improve the health of women. Soon, we'll also announce new grantees whose work can help deliver on those priorities. Each of these investments and commitments are in their own way historic. They're contributing to revolutionizing women's health in a way that we haven't seen before and ushering in a new era for our space. So the question now is, how can we use this drive and momentum to truly deliver on our vision of a more equitable R&D system and further advance the Sustainable Development Goals in the process? We are already making progress on at least two of these decisive steps that I mentioned earlier. Donors are starting to put more money towards women's health, and we're on a track to better tools for women soon. What comes next to support long-term change? We want to make sure that women themselves play a central role in the women's health innovation ecosystem. From R&D to laboratories and clinics, where innovations come to life and are tested, to boardrooms, where priorities are identified and policies are implemented, to government agencies and philanthropies, where funding decisions are made. By empowering women's voices throughout the R&D process and ensuring more male allies are supporting them along the way, we can support more women to lead healthier lives. Every single person in this room can play a role and help to make this shift happen. I would say for researchers, be curious, ask questions, challenge the status quo. For policymakers, science is great, but we need policies to make real change stick. So we need you guys to come in and implement policies that bolster the research pipeline and make sure women everywhere can access the innovation. For private sector partners, we need you to come in and help us innovate and develop new solutions for issues. And for funders, we need more of you to come in under the tent and join us in elevating the need to address the women's health gap and to fill it. I'll just throw out a plug for those in the US, vote. If you've not registered to vote, please go do so, because the people you elect will determine what access to healthcare is there for you as a woman. It will take each and every one of us to do our part to make sure the health needs of women are finally met. To that end, I encourage you all to think about how you can show up for women's health even after we part ways. It can be as simple as bringing more of your colleagues into the room for the next discussion, or taking conversations you've heard today back to your partners to see how you can incorporate the points we've discussed into your work. By working across sectors, we can build a more inclusive women's health innovation ecosystem. Together, we can do what it takes to improve women's health and meet the world's sustainable development goals at the same time. Thank you.
Yes. You can sit there. So, hello?
Hello, hello.
Okay.
Hello.
Well, now, thank you so much for that wonderful talk, and we're opening the floor for Q&A. But before, if you have some questions, they'll be passing some mics around. But I would like to ask you a question first. Okay. Rue, you're a physician in training, by training. You also worked in the pharmaceutical industry, and now you're leading teams at the Gates Foundation. How do you bring together those various perspectives in the work to advance women's health innovation?
That's a great question, Irene. I mean, I hope that all of my experiences up until this point have laddered up to the work that I'm doing now. I mean, I think as a clinician, I felt very close to the women that I provided care and services to. And as a woman, as a mom myself, I think I could relate to a lot of the issues and concerns. I did spend about 15 years in pharma in clinical development of drugs and treatments for women. And in that experience, I think what really stuck out to me is the role the private sector can play. By advancing priorities in that sector and just saying that a company or an organization, a research organization, commercialization organization is taking a position that they want to be in that space, that's a really strong statement, and it also reiterates the importance of the field, for sure. And now at the foundation, you know, we are thinking about funding and how to generate more funding because we know the women's health gaps are so large. It turns out the foundation, the Bill and Melinda Gates Foundation, is the second largest funder of women's health R&D. We're second only to the NIH. And we weren't even trying to be. It just kind of happened. But it just shows that there's a lot of room for others to come into this space, and we welcome any funding organizations to come and join us. So I think being able to kind of see the priorities from the different perspectives is really helpful as we think about how to move it forward. One point I'll also make is because the gaps in women's health are so large, that any research and development that takes place to just increase our understanding of like reproductive biology or you know, therapeutic drug levels in the female reproductive system, while I'm sitting in a role where we're focused on women and girls in low and middle income countries, those scientific advances that we fund in that area, because so little is known, will actually improve the science for women all over the world. And so that's the point. Like a small investment, what you may think is a small investment in this space will actually have exponential impact because so much remains to be known.
We have a question from the audience. Yes, sir. It's on.
I think it's on if you just hold it up. Yeah. Not that well.
It doesn't tap.
There we go.
Yeah, there you go.
There we go. There we go.
Yeah, thank you so much. And when you are talking, just it resonating about my mom, that what I seen in my childhood. I'm from Bangladesh. I'm a professor and scientist and as an entrepreneur, innovating things, how we can create a accessible, affordable, preventive things for the women, especially in LMICs. So I think in the world, in the research, we're mostly focusing on treating the diseases. I think we need to collaborate with developed country scientists and developing country scientists to work to prevent diseases rather treating diseases, because the treatment of disease is very expensive and prevention is very cheap, as you said. So I'm just thinking of how can, based on my experience, I use artificial intelligence. I have a team to work on how we can give access to preventable health risk assessment, especially sexual health, reproductive health, endometriosis, and other issues through the healthcare workers or directly to the females who have smartphones. So last year we got a grant from Bill and Melinda Gates Foundation to develop artificial intelligence for access to information. So how can we extend it together to access to risk assessment, screening, diagnosis, and timely referral to save women about their health? Thank you.
Wow, that was quite a question. I think, a starting point could be just people often don't know what's normal. If we go back to menstrual health, for example, girls don't know what a normal period is. When they start menstruating as early as age 8, I mean, I have a daughter, some of you have daughters, that is a young age. That is a young age. And so I would say just to start with talking about these things like menstrual periods, like menses tend to be stigmatized or people don't talk about it. They're whispered about in corners, boys don't know about it. We should just openly discuss what are, this is just a natural part of what human reproduction and just human biology. So normalize the conversation about what happens in your body, get the conversation going, and then people are in a better place to understand what is normal. There is a role for education, there is a role for health systems to come in and identify that. And once people have a better idea of what's normal, they can point out what's not normal so they can seek care for, as you said, conditions and diseases instead of waiting till they become really ill. So I think that's a really good starting point.
We have a question on this side.
Yeah.
Good morning. My name is Marlene Temmerman from Kenya, working in the field of women's health and STIs for a very long time. Thank you, Dr. Ru, for a very, very interesting presentation. Because from the field, I'm working with Aga Khan University in Kenya and also with ICRH, the International Center for Reproductive Health, where we do a lot of work on trying to improve prevention, diagnostic, and treatment. One of the factors I think that we don't maybe give enough attention to is the community mobilization and the education in the beliefs of people. And just one example, we work many, many years on HPV, cervical cancer, which is really a killer, and trying to have better screening methods to do the self-test, the self-sampling, etc., etc. Despite everything, only 20% of the women in Kenya have ever been screened. And it's not always because the test is not available, but it's kind of the belief that if something is wrong there, the woman is to blame. So I think we really have to take into context the local perception, the local culture, the beliefs. Everything that is wrong in health, it's the woman to blame. Surely, and I've seen patients who tell me, okay, you have an early diagnosis of cervical cancer. I'm not going to tell my husband. I'm not going to tell my mother-in-law. I'd rather die with my cancer then having something, then the community knowing, because then I'm bewitched, the stigma around it is huge. So I think it's great, and we need to develop the new technologies, but at the same time, we also have to understand the thinking, the perception of the community, and educate in our own families, but also in the communities. Thank you.
Yeah, it's a great point. Communities are very important partners in this work for sure. And I think you touched on, deeply held community beliefs. I think, community leaders, religious leaders, there's a lot of culture and nuance, and it's unique and different to each location. So absolutely, those things need to be considered as we're working in this area.
We have one quick question, if you can deliver it in 20 seconds.
I'm wondering how you can better communicate and share the results of your investments.
Okay, that's a great question. I mean, so all of our grantees are required to share the results. And I think we have a public-facing website where all of our investments are posted and listed. So we do include in if not all of our investments, most, a section that talks about how will the information be shared more broadly. And so it is built in there. It may not be, we can think about like how to make it more accessible or easier to find, but I think it is available for public awareness.
And my team will probably be very upset with me for this, but as we close this event today, we can probably send out a follow-up. So various requests for resources, we can send it to those that have registered. So just remind us, and we can pass along that website.
Oh, great. Okay.
Well, thank you so much, Dr. Chang. This has
Thank
been
you, Irene.
It's an absolute pleasure. For those that are on, continue the conversation. If you have additional questions, please feel free to drop them so we can be thinking about those areas, and where we can address them, we can address them after this program. Thank you very much.
Great. Thank you so much.